I'm a Brit living in America. I live in Florida. And I'm a homeopath. I'm a homeoholic.
That sounds painful.
There's no cure for this addiction.
There's no drugs?
No. So I'm a homeopath. I'm a jobbing homeopath, a jobbing researcher. What I'm passionate about is rigor. Homeopaths we have a tradition of being a little bit airy-fairy about the way we work, about our results. And over the years, I started when I was in my 5th year in practice, tracking my results. And I've gotten very good at it. I became more and more just the very act of doing it, of making the inquiry. How many people am I helping and how much? How many people am I not helping and why not? And just the inquiry, just the act of asking made me implement improvements to my practice, made me implement structures and all sorts of things that made me a better homeopath. My clinical audits enable me to keep in touch with my patients on a regular basis, and that patients tell me they really appreciate it. I'm not soliciting business per se, but it always increases my business to do so. In my own practice, I can, when a patient calls in, a prospective patient calls wanting to know if I can help their autistic child or their menopausal symptoms or their multiple sclerosis, I can look through my records and I can say with certainty that I have helped, whilst I cannot guarantee, of course, ethically or legally to help this person, I can say I've seen homeopathy help 80% of the autistic children, either moderately or a tremendous amount, usually in conjunction with other therapies. So the more that parents are doing, because I've tracked those, the more that parents are doing in terms of occupational therapy or physical therapy or whatever it is, nutritional counseling, whatever it is that the child needs in addition to homeopathy to potentiate the healing, that helps tremendously. The menopausal women have a great track record with these, with helping women through the transition, menopausal transition to homeopathy is spectacularly effective at alleviating hot flashes, joint pains, depression, all of the usual suspects. And multiple sclerosis, in my experience, is a very difficult disease. The patients that I've attracted have usually very advanced symptoms, and I've not been able to help them, and I say so. I refer those patients to the acupuncturist or homeopath in my town who I know is getting results with patients like this. So if you collect the data intelligently and then you interpret it correctly, because those two are very important factors, then you can use it brilliantly.